Diagnosis of viral disease, direct diagnosis, isolation, experimental animal inoculation, tissue culture, detection by enzymatic activity. Number 2, enzymatic activity, electron microscope, immunoelectron microscope, detection of the nucleic acid, the viral diseases, experimentally transmission to the animals to produce virus which can't be propagated in vitro, to study the pathogenesis of the virus infections, to test vaccine safety, but they are increasingly being discarded for the following reasons: limitation, breeding and maintenance of the animal infected with pathogenic virus is expensive. Whole animals are complex systems in which it's sometimes difficult to discern events. Results obtained are not always reproducible due to host variation. Unnecessary or wasteful use of experimental animal is increasingly regarded as morally questionable. Serological diagnosis, tissue culture. By using tissue culture, either primary or cell line specific CVE must be detected in the grown culture. Cytopathic effect. Usually the cytopathic effect followed by specific identification using ELISA, IHP, IFA and RIA. Nature of the antigen-antibody reaction. Nature of antigen-antibody reaction. Lock and key concept, non-covalent bond, hydrogen bonds, electrostatic bonds, van der Waals bond, hydrophobic bonds, multiple bond, reversible bond, the affinity, the length of reaction between a single antigen determinant and single antibody combining site, the affinity, attractive and repulsive factor, avidity, the overall strength of the binding between an antigen with many determinant and the multivalent antibodies. Specificity, the ability of an individual antibody combining site to react with only one antigen determinant. The ability of the population of antibody molecule to react with only one antigen. Cross-reactivity. The ability of an individual antibody combined site to react with more than one antigenic determinant. The ability of the population of the antibody molecule to react with more than one antigen. Shared epitopes, simple epitope, similar epitope. Factor affecting measurement of the antigen-antibody reaction, affinity, avidity, antigen-antibody ratio, and physical form of antibody. Test based on antigen-antibody reaction. All tests based on antigen-antibody reaction will have to depend on the lattice formation, or they will have to utilize ways to detect small immune complexes. All tests based on antigen-antibody reaction can be used to detect either antigen or antibody. Agglutination test, agglutination or hemagglutination, when the antigen is particulate. The reaction of an antibody with the antigen can be detected by agglutination, clumping of the antigen. When the antigen is an erythrocyte, the term hemagglutination is used. The term agglutinin is used to describe antibodies that agglutinate particulate antigen. When the antigen is an erythrocyte, the term hemagglutinin is often used. All antibodies can theoretically agglutinate particulate antigen, but IgM, due to its high valence, is particularly good agglutinin, and one sometimes interfere that an antibody may be the antigen IgM class if it's good agglutinate antibody. Qualitative agglutination test. Agglutination test can be used in qualitative manner to assay for the presence of an antigen or an antibody. The antibody is mixed with the particulate antigen, and the positive test is indicated by the agglutinate of the particulate antigen. A patient red blood cells can be mixed with antibody to blood group antigen to determine a person's blood type. Agglutination reaction. heme agglutination. The basic principles of heme agglutination assay is formation of clumps, agglutination of small particles coated with antigen when exposed to antibody specific for the antigen. Combined antigen antibody allow them to bind. The antigen is either a native constituent of the particle or is chemically attached to a particle. Antibody is added either on a solid or an card or in a tube. Detect antigen antibody binding. The particulate will form visible clump in antigen antibody binding where or the particle will remain dispersed if antigen antibody reaction occur. Agglutination reaction. Particles. There are three types of particles commonly used in agglutination reaction. Erythrocyte RBCs, bacterial cell often stained to make the clumps visible. Latex particles. With latex particles, the antigen are chemically attached prior to running the test. Applicant. Blood grouping. A view of the bed. This is blood typing. Anti-globulin Combs test. Direct anti-globulin Combs test. The reagent. Anti-globulin to canine antigen patient sample. Positive sample patient antigen present on RBCs. No patient Ig present. Here the agglutination. Positive anti-globulin causes RBCs to agglutinate, indicating presence of patient Ig on RBCs. Indirect anti-globulin Combs test. A normal RBCs patient sample serum, positive sample and negative sample, and this is a positive result, negative result. Combs test. In the direct anti-globulin test, the patient erythrocytes are tested for the presence of the patient antibody already bound to them. In an indirect anti-globulin test, the patient serum is tested for the presence of antibody that can bind to erythrocyte of normal. Latex agglutination test. Rheumatoid factor. Latex agglutination test. Rheumatoid factor. 2 latex agglutination test. Positive test. Clumping of the latex particle. The bottom negative result. Covalent attached. The antigen IgG is covalently attached to the latex particle. In this test, presence of rheumatoid factor antibodies to IgG of the same animal is detected by clumping of the latex particle. Antibody to bacterial antigen. Hemagglutination inhibition test. Some viruses are capable of binding to an agglutinating erythrocyte of particular species of mammal, usually different from that of the natural host. The basic principle of the heme agglutination inhibition test is to inhibition of the heme agglutination induced by these viruses. Combined antigen antibody allow them to bind. The antigen and the antibody are mixed together in the tube or micro titer well. Detect antigen antibody binding. RBCs of appropriate species are added. If antibodies were present, RBCs are not agglutinated because antibody inhibit binding to the RBCs. If the antibody were absent, RBCs are agglutinated by the virus. Example: equine encephalomyelitis, influenza virus, Newcastle disease virus, paramyxovirus, parvovirus, carine, porcine, and parainfluenza 3. Principle of HI. This is the positive and negative results. We test serum without antibodies, with or without antibodies. The RBCs of appropriate species, virus surface glycoproteins. This is the positive result and this is the negative result. Heme agglutination inhibition test for Venezuelan equine encephalomyelitis virus. From left to right, the result of the serum sample. Heme agglutination inhibition test for swine influenza. From left to right, the result of the serum sample. precipitation test, agar gel immunodiffusion. A plate is prepared with an agar gel into which antigen and antibodies can diffuse. Wells are punched into the agar gel and antigen and antibody are placed into those wells. Sample being placed into a well on a gel that has been poured on the glass slide. As the antigen antibody diffuse toward one another in the gel, they set up concentration gradient and begin to combine.